Welcome back. Well, it is the most frequently performed major surgical procedure for women in the U.S. That's a good stat. And then according to a national study, women in the South are actually more likely to have had it than any other region. We're talking about hysterectomies. I know you're on the edge of your seat there, but anyway, apparently 65% of women are unaware of the alternatives to traditional hysterectomy procedures. So here to give us some options with Texas Women's Hospital, Dr. John Irwin, and of course one of his patients, Miriam Westmoreland. Thank you guys for being here. And I'm actually going to start with Miriam, because Miriam, you had to have this surgery at an early age. You were 38 when you had a hysterectomy.
Very young.
But what were some of your symptoms?
Well, you know what? It really, I didn't have to have this. It's something that was, it just made my life so much better. And my symptoms were, we just have to get this over with. Really yucky.
Period.
Periods.
Just
I said
say it. It's okay.
Sorry.
It's only women watching.
We'll call it the P word.
Sorry, Doc.
Yeah. Anyway, so I had a regular checkup, you know, annual checkup, and he came in and said, "How's everything going?" "Fine." "How are you feeling?" "Fine." He said, "Need to talk about anything?" And I said, "No, I'm really great, except I have these just long, yucky,
horrible periods." Right.
And
She's so
I'm a
cute.
florist. I stand up all day for work. I'm a freelance florist. And so, you know, if you stand up all day, it's just even worser.
Right.
And so he said, "Well, it doesn't have to be that way." And I said, "Well, what do you mean?" And he said, "There's a new procedure that we can perform on you. You're the perfect person to have it done. But you have to be sure you don't want to have any more children." And I have 2 children. I have a 14-year-old boy, sorry Jake, and a 10-year-old girl. And at the time I was 38, and he said, you just, you know, it's not reversible. If you have this procedure, you won't have any more children. So at that age, you really have to think about it.
Right, and just for a doctor to look at you at 38 and say you need a hysterectomy, if you want to get rid of this heavy menstruation.
Right, well, I had a lot of endometriosis.
Endometriosis?
That word, yes, endometriosis. Okay. And that is what caused so much of the pain. And so he said, you know, we can do this so easily.
Well, that's when I came down to the green room, that's what I asked you, Dr. Irwin, because I said, I guess 90 million women have endometriosis, or apparently some stat like that, but that this is an easy procedure, and you don't always have to have a full hysterectomy to basically cure the endometriosis.
Oh, that's right.
So tell us a little bit about what this procedure is and why it's different from the traditional hysterectomy.
Well, in a traditional hysterectomy, there's a large incision. You end up staying in the hospital for 3 or 4 days. You're probably out of work, or out of commission at least, for 6 or 8 weeks. With these minimally invasive or endoscopic hysterectomies, this is a traditional type hysterectomy.
Like about a 5-inch scar to the left.
It is, or bigger. This, on the other hand, is how we do the laparoscopic hysterectomies, and this is developed over the last 5 or 6 years.
It's like a knee operation. You know when they used to scope your knee?
Absolutely true. I mean,
you just get the 3 little...
A lot of medical specialties, gynecology included, are going to these minimally invasive procedures, orthopedic surgeons, cardiovascular surgeons, and so forth. Rather
than a 5-inch scar and then pulling apart the muscles to then take the uterus out, it seems like it would... I mean, how did it feel to you? What was your recovery time?
It was so easy. I literally was in at 6 in the morning on a Monday. I was home before noon, and by Friday, I was driving myself for a pedicure.
That's pretty remarkable.
Yeah, it was pretty fine.
Well, are there any dangers to this? I mean, as opposed to the other one, is there any way you would not do the laparoscopy, instead you would go back to the traditional hysterectomy?
Well, there certainly are a few, but I would say that 90% of hysterectomies that are performed in the United States could easily be done laparoscopically.
Well, you know, it's because my mom went in for a hysterectomy, and she's 60. She went in about, I think it was about 55, and she ended up having the full surgery and then had to have a blood transfusion because she lost so much blood. Right. And it took weeks. I mean, she kept saying, "Don't make me laugh," because it was so painful. And of course, that's impossible, because then when somebody says that, that's all you do.
Well, literally, with this surgery, the average blood loss is about 1 ounce of blood. Whereas in a traditional hysterectomy, you're talking about a pint. It's unbelievable.
1 ounce to a pint.
Yes.
And do you find that in terms of the women that you're finding all the way from 38 till it's fine until, you know, what my mom's age, a typical age of getting a hysterectomy is what?
Well, it's probably more in your mid to late 40s or 50s, but a lot of younger women, this is now an option where, you know, someone like Miriam with an active lifestyle, 2 young kids, it's hard, 6 weeks.
Yeah, 6 weeks.
That's very, very difficult. And so to now transform that into 5 or 6 days.
And
so easy.
It seems that you were, you know, up and moving. You said you got a pedicure, you went to a party, and you did all of that. So other women, though, that you've talked to, endometriosis is sort of a tricky thing to diagnose. Apparently, you have to, if you really want to know if you have it, you have to use the laparoscopy.
That's right.
So what are the symptoms that you can tell women to look for if they feel like maybe they have pain there, or what are some of the other symptoms?
Pelvic pain, abnormal bleeding, extra heavy bleeding.
So that's pretty common, though. Those are common. Okay.
Very common.
Well, coming up, you know, we're going to stick with us because we're going to keep you here, and thank you. I want to thank you, Miriam. But the doc is staying in the house because when we return, we find out other common surgeries that can be performed using this new procedure. We're minimizing hospital stays and speeding up your recovery time. Next. Welcome back. If you're just joining us, we're talking about a procedure that touts shorter hospital stays, less pain, and quicker recoveries. Can't be wrong with that. All right, well, we just learned this procedure is largely used in hysterectomies, but there are a spate of other operations that can also be made easier. So joining us to explain from Women's Hospital of Texas, Dr. John Irwin. Thanks again for coming back and joining us. So I look over, and all of a sudden, the doctor has brought in a lot of equipment. He's got a lot of tools. So what is all this stuff that we have here?
Well, you saw on the graphic the little. This is how we have access into the abdomen. And these are a little port thing, and this allows us to take instruments in and out. This hollow tube. So this is placed in the abdomen, and then you can put these. It's
kind of like when they they're taking your blood,
right,
and they keep the one tube in, and
and then you can put the laparoscope, the little scissors, graspers, and so forth.
I'm just going to pick this up because this is actually the camera.
This is the laparoscope with the video camera at the end. All of this surgery is done on a video camera. There's nothing. There's no inside the abdomen, so it's all done on the video.
That's why you don't have to do the 5-inch scar.
That's right.
That you would
need.
The
scar is this to fit that in.
Goodness gracious! So this is all of the equipment that you would use.
Right. This fits into this port, so it's now inside your body. Inside your body.
So what other surgeries? We said hysterectomies, and also I did want to clarify that because you told me this, that not every woman who has endometriosis needs a full hysterectomy.
No, a hysterectomy for endometriosis is only done if the woman is past doesn't want any more children. I mean, endometriosis is a common cause of fertility problems and.
But you can help fix it with just laparoscopy and other things like hernia.
Hernia repairs are commonly done now. Appendectomies are commonly done.
Gallbladder
surgery. Even the oncologist at our hospital, the GYN oncologists, do radical hysterectomies for invasive cancer through a laparoscope. It's most amazing.
Even with cancer, you wouldn't need to open up.
Nope.
Wow.
Do node dissections, the whole thing.
Now, something we talked about earlier with this technology, which I think a lot of women would want to know, is that if they do have to get the hysterectomy, this technology will then allow them to not be precluded from any sort of enjoyment in their sex lives, which a lot of times the hysterectomy does.
Well, that's exactly true. In traditional hysterectomy, the cervix was removed. In most of these laparoscopic hysterectomies, we do not remove the cervix, and so orgasm, sexual response, and so forth is just like it was prior to the hysterectomy.
And are you finding that's actually very great? You know, do you find that women come in and then you say that this is a bonus to that women really respond to that part of it?
Well, certainly. I mean, it's because most women have heard about this business with sexuality and sexual response after hysterectomy, so they're very interested in that.
And is this part of the thing that you tell them about the procedure, though?
Sure.
Yeah, right on. We love the doctor. The doctor's in the house. We love him. Okay. Well, I think we better end on that high note.
There you go.
But thank you for joining us.
Pleasure.
Give it up for Dr. Irwin. You have a website. womenshospital.com that we can go to. You can find out all about that, which is good. So stick with us, though, because we've got some more information coming around on the other side of this. All you have to do is know that we are going to be